Hello, I am Dr. Ridhi from Saritha Dental Clinic. Today, the topic of discussion is dental management of pregnant women. When a pregnant woman approaches a dental clinic for dental care, special consideration should be given to accommodate the physiological needs of the pregnant women. During pregnancy, the dental treatment may be modified but should not be withheld. So, we should give a special consideration, but keeping in mind the complete risk of a pregnant woman and the fetus. Estrogen increases by 10 folds and progesterone increases by 30 folds. That leads to increase in heart rate by 20 to 30% and cardiac output increases by 30 to 50%. So now we will discuss a very important topic, supine hypotensive syndrome. When a pregnant woman is in her second and third trimester, that time we should not make a pregnant woman to lie down on the dental chair in supine position. She should be sitting little upright and more towards the left side, or we can put a small pillow under the right hip. The reason for this is, if a pregnant woman lies down in supine position, it will lead to the compression of inferior vena cava that further leads to less venous flow to the heart, which further leads to the less cardiac output and decrease in heart rate. So now we will discuss the timings of treatment, that is the first trimester, second trimester and the third trimester. First trimester, we should avoid all the dental procedures unless any emergency procedure is required because of the vulnerability of the fetus. Second trimester is the safest period from 13th to 21st of the week. In this period, we can safely go for root planing, scaling procedures, polishing, curettage, small restorations, periodontal health, and further we can control active diseases also, because during this phase the fetus is stable and there will be no nausea and vomiting. Third trimester, scaling and polishing can be repeated to minimize the hormonal changes occurs during the pregnancy to maintain the healthy gingiva and the oral hygiene. But as we have already discussed, patient position should be carefully taken care and patient should be given short visits according to the health and the requirements of the patient. Next is dental radiation exposure. Fetus is most vulnerable to radiations from 2nd to 6th week of gestation period. So during this period, we should avoid taking any radiographs. Further, if for the treatment radiographs are required, special considerations should be done. First, patient should wear a lead apron, thyroid collar, modern films, and avoid taking retakes. Next is the prescription of drugs. Common analgesics like paracetamol and ibuprofen can be given safely, but we should avoid giving aspirin. Being non-teratogenic in nature, it leads to hemorrhage of a pregnant woman and the fetus and leads to further delay of labor. So we should avoid giving aspirin during the second and third trimester. Common antibiotics like amoxicillin, penicillin, clindamycin, metronidazole, further chlorhexidine mouthwashes, rinses can be done safely, but we should not give tetracycline as we all know it leads to tooth discoloration. Next is the use of local anesthesia. Local anesthesia penetrates the placental membrane. So we should be little careful while using the local anesthesia. It should be prescribed in small doses and avoid giving the excessive doses and preferably without vasoconstrictors. Topical fluorides. Using of topical fluorides, there is definitely no side effects of using topical fluorides during any term of the pregnancy. It inhibits demineralization and promotes remineralization of the early caries. If you are pregnant or you know anyone is pregnant in your family, please do visit the nearest dental clinic or visit us at Saritha Dental Clinic. Thank you.